If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you. Well, you're looking pretty clean and tidy over there.
Yeah. I decided at 54, I'm just admitting that I'm bald. Gonna go high and tight and just not do the comb over thing anymore.
I like it.
Yeah,
I like it. Yeah, I actually think it makes you look younger.
Yeah, I've heard that from a couple people, and most importantly, I'm glad that you like it. My wife likes it. That's the one person that I actually cared about.
That's right.
Although I love you, I care more than she thinks.
That's right.
So.
That's right. Well, you look good. You look good,
and it's easier. Like now, I don't have to worry.
Dude.
I just I did Pilates this morning. Usually, I'm like stressed about remembering everything, and I just don't do anything. Right. Yeah.
Yeah. And it's not going to move, right? It's just kind of stable. That's good, man. That's good. What's going on this week?
Quiet week. I mean, I had a lot of portfolio companies. We had changes in various portfolio companies that I can't talk about, but some things that are really good and some things that are hard. It's sort of a mix, kind of like the economy. Some companies are doing great and some not so great.
Dude, I had the exact same week.
Yeah.
Exact same week. Yes. And it's like the things that are happening in the market right now create challenges for some companies and organizations and create massive opportunities for others. And I think, in the rundown, we're going to go through some of those varied results, at the highest levels. But yeah, I mean, this is it's a really interesting time where some companies are going to thrive and, and some companies are going to really struggle. And it's just kind of the way it is. I mean, it's the benefit of having a portfolio, right? I mean, for sure.
Yeah. Yeah, that's right. I mean, I think if you are sort of in the world of bits and software, it's pretty easier. It's easier. It's pretty good. It's better. Yeah.
Yeah. It's pretty good. And then also this was audit week.
Yes.
And maybe that's all I'll say about that.
Yes.
You talk about an industry that I think AI is going to have a massive impact on. I think the world of audits for sure. The more that we can depersonalize those interactions would be great.
Yes.
I would appreciate that.
Yeah, and the value of credentials. I've been thinking a lot about that as we go into AI. We're like, a lot of the things I need an auditor to do, at the very basic level, we show them the management's version of all the financial statements, and they audit it. They review to make sure we're doing the right thing.
That's right.
And they have a certification to say they're qualified for that.
That's right.
That certification, it's going to keep them valuable for a period of time, but eventually they're not, the certification maybe is not as valuable as the service.
Yeah, and what does the certification do? It validates that the person has actually passed the test.
Right.
That's really all it does, right? And you can very easily test AI to see if it knows the same thing.
Yeah,
it's just called benchmarking.
It does.
It's called benchmarking, right? So, again, the analogs to replace, human labor with digital labor continue to get stronger and stronger. All right, we have quite a compelling show today, and let's go ahead and dig in. As always, start with the economy. GDP, what a incredible result here. Negative GDP, negative 0.3% GDP. The chart looks absolutely terrible, but not surprising, right? Not surprising. We kicked off the first 100 years of Trump's term.
100 days. It's felt like 100 years.
Oh, did I say years?
Yes. It has felt like that.
I'm gonna hit my head on the mic right now. The first 100 days of it does feel like that of Trump's term, and we're in a trade war, right?
Yeah.
We're in a trade war, and people anticipated the trade war. He said he was going to lead with tariffs. He's done it. He's actually done it, and so huge shift, particularly in the net export category for GDP.
Yeah, that was really the that drove the change. So negative GDP primarily because we imported much more by a factor of 3 or 4 than we exported. We always import a little bit more than we export, but in Q1 it was a lot more.
Mm-hmm.
And I think that is, somewhat to be expected. No one expected this extent, but people stocked up before the tariffs took effect. My
Sure.
portfolio company certainly did.
Sure.
I think everyone did.
Sure.
So I think that drove the result.
Yeah. Yeah. Interesting. I hadn't really thought about it, but in this article, this Wall Street Journal article, they're talking about how Trump on Truth Social said, "This is not my stock market. This is Biden's stock market. You know, you can't blame me for it." You know, of course, if it's going well, he'll say
it was his stock market in December.
Yes.
When he hadn't even taken office yet.
Yes.
Because it was going well.
Yes.
Now it's Biden's.
Yeah.
So.
Yeah. He never misses an opportunity to take credit for all the good things and pass blame for all the bad things. Yeah. That's a consistent trait for him. All right. So ADP numbers, they always front run the BLS report. They are showing that there's a forecast of 120K that's down from 147,000 in March. But last time when we reviewed the ADP, it was supposed to sort of foreshadow what was actually going to happen, and it was quite off the mark that BLS actually came out with the week afterwards.
Right. Yeah. So the forecast was 120, and the ADP actually delivered, say, 62,000. So less than half. Well, half.
Okay.
So for April, the forecast was 120, down from March 147. The actual in March was 147, and it was 62.
ADP is now saying 62.
That's what actually happened in April. Now, they may not reflect BLS. You're right. It's a week in front of BLS.
Yes.
Typically, I have, and a lot of people watch this as a early indicator, but it's not tracking exactly. So we'll have to see. But I think it's not a good sign.
Yeah. It looks like ADP's chief economist here is basically saying that employers are not feeling comfortable pulling the trigger on hires in this environment.
Right.
It makes sense, right?
Yeah.
I mean, no one wants to actually provide guidance. No one wants to forecast anything.
Yeah.
So if you can't do those things, it's kind of hard to make the investment in
to
human
new
capital.
people. Yeah.
UPS to cut 20,000 jobs after Amazon breakup. So this feels to me like not so much a tariff story, but more the continuation of Amazon building out their entire vertical stack. Very, very competent in delivery, at least across the United States at this point, and probably had the leverage to negotiate very, very shrewdly with UPS and ultimately leading to a change in the contract, which forced UPS to let go of 20,000 people.
Yeah, I think it's partially Amazon. I think it's partially there's going to be less goods being shipped around for a period of time. So they laid off 20,000. They have about 490,000 workers. So it's not a huge percentage, but it's a pretty big headline number.
Yeah.
Then they closed 73 buildings.
Wow.
Which I don't know how many buildings they have, but 73 across the country seems like a pretty big number, too.
Yeah, Amazon is their biggest customer, so I would imagine there was some significant concentration risk in that contract.
Right. Oh, yeah, definitely.
Yeah. All right, and then a little bit more about the international trade war. Wall Street Journal article, headline, Beijing doesn't want America to see its trade war pain. So obviously, this kind of mucking up the global trade system is painful for all, and I do think that at least in the social media propaganda war, China's done a great job of presenting
they did that,
themselves.
Like, we will not kneel or whatever the title was thing. Yeah.
And very resilient in terms of like outing some of the bigger brands. There was that really great reel about how Birkins, like really cost about $500, but they should sell them for $10,000. You could buy direct from this Chinese warehouse for $1,000. So I think in terms of leveraging TikTok and leveraging Red Note and social media, they've done a great job with that. But of course, on the ground, it has to be hurting them economically.
Yeah, I mean, the U.S. is, I think, by a decent margin, their biggest customer for exports from China, imports to us.
Yep.
And that's completely turned off right now. So we are suffering, but I think China is also suffering.
Yeah, there's this chart here of year-on-year change of China's exports, and 2025 is down significantly, 10% down.
Yeah.
So.
Yeah, that's right.
It's pretty meaningful.
Yeah, and I think to me, both leaders seem pretty resolute at continuing to fight for a little while. Maybe there'll be some.
I mean, I don't think. I think at least what I feel like I've seen over the last week, to 10 days is, you know, they're both angling towards saying they're going to get together and come up with a solution, but neither can look weak to their country, to their home country, or to the rest of the world.
Right.
And so I feel like we're seeing some level of respect and diplomacy at the highest level between Trump and Xi, and at the same time also them trying to represent the strength of their respective countries.
Yeah.
And then Canada. So Canada has elected Mark Carney as the prime minister. This is kind of a reversal of the trend that was happening in Canada prior to Trump taking office calling Canada America's hat and saying that it would be our 51st state and all the other fun things that he said that has caused Canadians to not purchase bourbon or not travel into the United States. And so now they have liberal leadership at the highest level. And this was not where it was headed. You know, Trudeau was kind of out of favor. And the Conservatives were mounting a pretty strong sort of populist wave. I would say, you know, in line with Trump during the election season. But once Trump actually got in office and started disrespecting, even Pierre, you know, had to start saying, hey, you know, forget this guy. So this is it's interesting to see how Trump is causing boomerangs of sort of political fortune in the countries that he's targeting. Yeah,
that's right. I mean, I think there is no question that Mark Carney ran basically on opposing Trump and this, you know, aggression from the U.S.
Canada's strong.
Right. Yeah. Right.
Yeah. So very, very interesting outcome there. And I think that storyline will continue to play out from a tourism perspective, from a tariff perspective, from a, you know, shared resources perspective, and probably even from a defense perspective. You know, I think there's so much there between our two countries that have just been taken for granted as it's intermingled.
Yeah.
And I think we'll start to kind of see as they uncouple a little bit, while these two newly elected leaders figure out what their path forward is. But certainly Carney is very, very strong on taking Canada in a direction that does not make it dependent on the United States. VC rundown. Plenful raises $50 million in a Series B funding. San Francisco-based provider of AI workflow automation. They are modernizing healthcare operations. There was $50 million in a Series B. Was led by Mitchell Rails and Arena Holdings, participation from Notable Capital, Bessemer Venture Partners, TQ Ventures, SUSE, and other investors.
Yeah, and this is sort of, I think, really, really good. They're bringing AI workflow and AI automation to help our workforce, our people in healthcare, and our people need a lot of help. And so I think it's great.
So they are currently working with Medical University of South Carolina, Sensora, Renown Health, Shields Healthcare Group, and Samaritan Health. So no super big names at the moment, but that's a pretty big round. So we'll see how they continue to gain market share. All right, next up, HealthPlan Data Solutions secures $15 million with MK Capital. So this is a pharmacy payment integrity and benefit optimization company. They are based in Columbus, Ohio, and MK Capital alongside Tamarind Hill, Jobs Ohio, and Rev One Ventures are friends in Columbus.
Yeah, and I don't know this company, but I know, as you said, I know several of the investors. I know Tamarind Hill as well and Jobs Ohio. They're good investors, and it seems like a great space. I mean, we have portfolio companies in this space. There's so much opaqueness, and people don't understand what they're spending money on. So bringing transparency, bringing information can be really helpful there.
It's an overall theme that I think people are really buying into right now. So it's really smart. And obviously, you know, PBMs, we talk about them, feels like every single week, the opaqueness that they bring into the market. So definitely, good deal here, and congrats to HealthPlan Data Solutions. All right. Trek gets $11 million to unlock healthcare's pricing black box. This is Axios Pro. So Trek Health is a startup using AI to help healthcare providers get accurate payments. Their $11 million came from Madrona, and it was their Series A.
Yeah, so this is on the same sort of theme. Trump version 1 required cost transparency by health systems and payers. So you have to put all the contracts out there in machine readable code. But it is very difficult to get insights from that.
Mm.
And so Trek is grabbing all of that information and sort of reconfiguring it so it's useful for people as they're negotiating new contracts or whatever they, are doing in the marketplace. They provide that insight.
Mm-hmm.
I think it's smart.
Yeah, for sure. The data is machine readable. It's pretty comprehensive, but very, very difficult to parse through. But very, very valuable data that can be used strategically for like pricing and negotiations and all sorts of other things. So pretty smart here and nice size round for Trek. Also, Axios Pro, Blooming Health raises $26 million for social services access. We were talking before we started hit record that neither one of us knows that much about the social services space.
Yeah.
We do have a portfolio company called Samaritan that has worked with the homeless population. I think they started in San Francisco.
I think they started Seattle.
Seattle. Seattle. Okay.
But yeah, they're in 6 cities now. I'm actually talking with, they have a new CEO I'm talking to tomorrow.
Okay.
But yeah, this was surprising that this company, their clients are community organizations and government agencies, as reported on Axios, that they're bringing in $10 million in revenue, and Insight Partners, which is a great firm.
It's a great firm.
And not necessarily focused on charitable efforts. I mean, they're definitely a for-profit group.
Yes.
They are putting $26 million into this company. So it makes me think I want to learn about this more.
I agree.
Must be a big opportunity for Insight Partners to put money in there.
Yeah, I agree. I want to learn a lot more about it as well. It feels like something that is very Byzantine, probably a lot of like very small, disparate organizations.
Yeah.
You have to, and it's very valuable to sort of stitch a network together of all of them, leveraging data, technology, probably some AI as well. So I agree. I want to study this company, and maybe through the company we can better understand the space.
Yeah.
All right, going into policy. So senators introduced RPM, Remote Patient Monitoring Access Act, to increase rural payment rate for remote monitoring. So obviously, I think we both are aligned. This needs to happen.
Yeah.
There needs to be more support because we know rural hospitals will continue to close, especially given the changes that the House GOP is looking at doing to Medicaid. Right? We know there's no question.
Remote monitoring has been good all around. I mean, there's not anyone I know that is against remote patient monitoring.
Well, it's just been too much of a pain to figure out how to actually get it paid for, especially in rural communities.
Yes, and so in the rural communities, it's more needed.
Yeah,
because it's obviously a much longer drive to your provider. If there is a provider within a reasonable drive, say an hour drive, there are communities now that don't have their providers within an hour drive. So Senator Blackburn from Tennessee and Mark Warner from Virginia introduced it, so it's a bipartisan bill.
Yep.
I think it's great. It's a long road to get this through the House and the Senate, but I'm a cheerleader for it. I hope it does.
Yeah, for sure. I think it's great. All right. Modern healthcare. Supreme Court rules against hospitals in the DSH case. This is the case Advocate Christ Medical Center versus Kennedy. Was the 7-2 decision, and basically this was around how the lives are being counted for Medicare and SSI, and effectively the courts ruled that they don't have to that CMS does not have to be hyper specific when they're counting the lives, which is going to mean that the hospitals are going to get less pay for taking care of this population.
Yeah, I think that's right. I mean, there was a effort by the Biden administration that I'm in favor of to try to get more money to these organizations that are really serving our most vulnerable populations. And Kennedy, what's one of the first things he did was change that. So they questioned it, but it's been shot down in lower courts and the Supreme Court now. So
yeah. So I mean, I feel like when we started this show, there was a rally of wins that hospitals were having, in the courts, and it feels like lately that those fortunes have turned.
Yeah.
All right, more modern healthcare. CMS explores limiting insurers' use of prior authorizations. I did not read this story, so tell me about this one.
Okay, so this is good for health systems.
Okay.
Also in HHS broadly, it's more Dr. Oz. So, I mean, I think everyone believes that prior auth, well, it's a necessary part of the payer's job. it's overused. I mean, I would say it's overused. I don't think we should reduce it altogether, but what CMS is exploring, and they haven't created a rule around it yet, but they're exploring limiting it or having a maximum number per month, per year, so that a payer can't just, as a policy, put prior auth on every procedure.
Right.
Obviously the details will matter, but I think that probably makes sense. I mean, prior auth should be utilized sparingly for things that are either very expensive or controversial. You need to have a lot of oversight and review, and it certainly, in my opinion, it has in the past been used too much.
I mean, I remember one time when I ran into a prior auth issue. It's not with UHG, and I won't say what the insurance company was, but I ran into a prior auth just trying to go, get a CAT scan. I mean, they run prior auth for like every single rad tech thing you want to do, and it's like, do you really need to do that? I mean, it's not that expensive, and B, if I've got a doctor's order for it, like just let me get the scan. You know what I mean?
Right.
So
right.
Yes, I agree. I think it's overused generally.
Yeah.
Okay. Humana bucks Medicare Advantage cost trend.
United Health Group came out first. They always announce first.
Yes.
And so they created a lot of fear in the market because their medical loss ratio was really high. They missed earnings. But we've had multiple payers now since then. So I think the trend is actually everything seems to be okay in Medicare Advantage. So I'm not sure the title makes sense, really.
Yeah,
but
got it.
But they performed well. They had fine earnings. They met their earnings. And, medical loss ratio was at 87. So it's, a little over the 85, but down from where they were a year ago, 89.
Which
so they're making
good.
Improvements.
Which is good.
Right.
Yeah. Yeah. I mean, they've been, I think, hyper focused because they've been targeted for more than a year now. So they probably have now a year of effort in getting that MLR down from 89.3 last year to 87.4.
Right.
That's pretty good progress, I would say.
Yeah.
That's pretty good progress. Okay. Fierce Healthcare, backstopped by Q1 overperformance. Tenet Healthcare will stay aggressive amid policy uncertainties to the health systems.
Similar to HCA, they met earnings. They beat earnings for Q1, but they didn't increase the year guidance because of the uncertainties around the tariffs and the economy and everything. Right. So that's what it's saying.
Better to just keep beating quarter over quarter than like.
Yeah, I think that's right. You don't really get rewarded much to increase guidance in this environment.
And you can get away with not doing it, right? The analysts aren't going to say, well, you performed well in Q1, why don't you revise guidance? They're not going to say that given everything that's going on in the market.
Because other companies, more the consumer focus, airplanes and travel and things, are pulling guidance altogether.
That's right. That's right. All right. This is Healthcare Dive. UHS, Universal Health Systems, sees behavioral health volumes drop in Q1.
So they missed earnings. UHS is kind of an interesting combination of they have acute care hospitals, but they also have behavioral health hospitals.
Yeah, and it's a pretty big behavioral footprint for them.
And so the admissions declined on the behavioral health side, and they missed earnings. So unlike HCA, CHS, Tenet, UHS is sort of the outlier here.
Yeah, I mean, but they're basically saying, and it's certainly true. Seasonality matters, weather patterns matter when it comes to healthcare, and they're saying that there's a leap year, atypical winter weather, or some other things like that.
Yeah, I mean, I think Tenet had a leap year too, but yes.
Well, no, but we're referring specifically to their behavioral health volumes. Tenet's footprint is more acute and surgery, right?
Yeah, so I think it's fine to say behavioral health is different than
I think it is different.
But the leap year stuff and weather is like everyone had a leap year.
No. Weather matters. Weather matters.
It matters more to behavioral health than other.
I would say so. Yeah,
okay.
I would say so. Yeah. I think so. You might skip the therapy, whereas you're not going to skip the doctor's appointment if you're sick. I think so. Teladoc acquires UpLift for $30 million, doubling down on virtual mental health despite BetterHelp's struggles. This is Fierce Healthcare. Usually our Teladoc stories are not very good. Just, you can look at their stock chart and see why.
Right.
BetterHelp, that acquisition has been kind of a disaster. I don't think that's hyperbole to say that, right? I mean,
I think that's right.
Okay.
Yeah.
Okay.
Yeah.
I don't want to bash Teladoc here, but BetterHelp has not been a good acquisition for them. So it is of note that they are continuing to invest in this space. I would imagine, though, UpLift, $30 million is not a lot of money for a public company transaction. And how much revenue did UpLift have?
15 million, two times revenue.
So they got 2 times revenue.
I mean, I fear I'm going to bash Teladoc as well. I think Teladoc is a struggling organization. They're the largest digital health platform out there. They were the first. And I think they're sort of buying things to keep growing and keep doing something.
But the crazy thing is nothing they've bought has been accretive.
Right, because their whole platform is struggling. They don't have it much differentiated. It's all sort of,
Are they still in the public market?
Yeah. So they missed Q1.
They should go private. Somebody should buy this thing private and kind of clean it up. I mean,
yeah. I mean, maybe it's still
got big distribution.
It's a melting ice cube in my mind. So it's like every quarter it's less good. They've bought. I don't know. They buy one thing a year, and they buy it, and then
they're going to have to go off the public market if they keep declining in value like this.
Well, that's why they buy things, because then they
get to stay.
You can get some size.
All right, moving into pharma, Novartis is going to buy Regulus Therapeutics for up to $1.7 billion. Regulus is a kidney disease treatment company.
Yeah, so these are 2 public companies. Regulus is a U.S. I think they're in San Diego, kidney treatment. So I think it's good to see M&A transactions happening. It's not a huge deal for pharma, but I think it's worth celebrating a transaction happening at all.
1.7 would that qualify on the public markets as mid-market, mid-size cap?
I think
1.7 make mid cap.
Oh, I think over. I don't know. I'm not sure.
Okay, I mean large cap's like 10 billion plus, right?
Yeah, I'm not sure about what. I think it sort of depends which
industry.
Part, yeah.
Which part?
Yeah,
which sector?
but probably it is mid cap.
Okay,
I don't know.
But it just seems like a decent place for a farmer to go fishing, right?
Yeah, yeah, that's right.
Mid cap stocks,
right?
All right. Pfizer expands cost-cutting measures, reaffirms outlook. The company expects to save an additional $1.2 billion from automation, AI, and other digital tools. So that is their storyline. So they're going to save money from AI and automation.
That's what
they're not talking about their assets in their portfolio.
They don't have pipeline to grow sales. So
yikes!
It's like, please don't look at the fact that we have no growth. We're just going to save our way to success, which does not work. I don't know where Pfizer is headed.
Cost cuts is kind of what they are doing. They're not buying companies; they're cost cutting. All right, this is a story I want to dig into a little bit. Modern healthcare, Hims and Hers, Novo Nordisk partner on GLP-1s. Okay, finally, we are now into the next chapter of this story. Right, the first chapter was Novo and Lilly, the real deal versus the compounders.
Yeah.
FDA, for a window of time, said we're going to allow the compounders because we have a shortage. We were past the shortage. FDA said you got to stop. Was it Hims that did the Super Bowl ad?
Yes.
Okay, so Hims does the Super Bowl ad, hoping to sort of win public, opinion in favor.
Right.
3 days later, FDA rolls out guidance. No, you can't do it. You need to start shutting down. And so, but in the meantime, Lilly has really been making tremendous strides, not just in terms of coming up with the next generation of things. They've got a pill on the way, but also just generally speaking, their products are winning in the market.
Yeah.
Their products are winning in the market.
They're able to go to direct. They have Lilly Direct.
Yes.
And which I think their pricing is a little friendlier.
Plug for our LP meeting. We were able to have Lilly Direct, Lilly Direct's SVP at our LP meeting, which was awesome.
Yes.
To learn more about that. And yeah, I mean, now the second chapter is the big brand distribution channel, Hims and Hers, is partnering with Novo, who I would consider in second place right now in the GLP-1 race. So great partnership, right? Hims and Hers now is legitimate, differentiated amongst all of these other direct-to-consumer brands. They're no longer a compounder, right? No longer an outlaw. And they're partnered with a great brand, Wegovy, from Novo. And Novo gets distribution. Novo doesn't have to try to figure out how to do a Lilly Direct. They just can now work directly with Hims and Hers. So this is this is a really smart, mutually beneficial deal.
I think that's right. It's two companies that both had challenges coming together and realizing, your chocolate will taste good in my peanut butter or whatever. Like that. Wegovy gets a reasonable price. I think it's $500 a month. So not the $250 to $300 that Hims was pushing before, but also much better than the $1,000. And they can say to the U.S. government, they're sort of being responsive around making things more affordable. And they both now are able to try to compete against Lilly Direct and others like that. So I think it's a good marriage.
Yeah.
Or a partnership, whatever.
I mean, to me, this starts a whole new chapter in the whole GLP-1 story, right? Because are others going to start striking these types of partnerships? Is Lilly satisfied with what they've pulled together with Lilly Direct and they're going to keep going, or will they in parallel, seek to partner with Ro or one of these other like really, really big brands? I mean, it's just an interesting question to consider what will happen next. And then what really happens to all the compounders that are left without one of the major GLP-1 providers, right?
Yeah. Yeah. Now, unlike Teladoc should have done this deal. Like, doing a deal where you have product and you're actually sort of making margin on it. That's what Hims has done for a long time. First with sort of male products, then female products.
Hold on. We got to dig into the article here. So it says right here that Novo is actually going to partner with Ro and LifeMD for a similar service.
So, they're sort of locking up all the market.
Yeah. So Novo decided they're just going to go work directly with all of the different. And then hours later, Eli Lilly said in a statement it had no affiliation with the telehealth company. So this is an interesting bifurcation of strategies.
Right.
Yeah. This is going to be interesting to sort of watch from here. Okay. Merck to spend $1 billion on new factory to make U.S. supplies of blockbuster drugs. So this is going to be in a new Delaware facility. It's good for Delaware. And add another $1 billion to Trump's tally of manufacturing that's being grown in the United States.
Yeah, which is great for our security of pharmaceuticals, good for job creation. I don't know if it's going to help jobs in the second quarter, but good.
No, but it does build to his narrative that he is rebuilding the domestic manufacturing strength of
there's no
America.
question that there's been both tech and healthcare and probably other things I'm not thinking of right now that are building facilities and investing in the U.S. because of the tariff policy. Yeah,
and also probably I think on the pharma side, probably also carrying favor with Trump that can be conveyed to their dealings with, RFK's HHS, right?
Yeah.
So I think that's also probably in there as well. Okay. Now to Health and Us. First story, amateur athletes are turning to Ozempic to raise their game. Runners, cyclists, and other fitness enthusiasts say weight loss drugs give them a performance edge despite potential risks. I mean, this is kind of the thing with athletes,
especially endurance athletes. Maybe
I think it's all athletes. I mean, look, I'm in the jiu-jitsu space, and the number of young people who are on tren and gear, and I mean, dude, they're not making any money, being jiu-jitsu fighters,
right.
And they're still, it's not even about that. It's about glory and whatever they think they're going to get out of doing these sports that are not, the NFL and the NBA and MLB, right? That actually pay people.
Yeah.
And
I guess there are weight classes. So if you are 5 pounds off the next lower weight class, you can cut weight and get that.
Totally. Yeah. And the thing about GLP-1 is it's like, I mean, it doesn't feel that far off from aspirin anymore. Everybody's on it.
Yeah.
Everybody's on it. So why wouldn't athletes be on it for a performance boost?
Yeah, that's right.
So
and I think I had heard about this, but I hadn't seen it in print before, the microdosing thing. So people are they're sort of titrating what amount do I want to do. It's not the recommended dose. They're doing less than that to try to try to, kind of titrate in their weight loss to where they want to be.
Telling you, man, the athlete world is a weird world.
Yeah,
you
that's
know,
right.
It's a weird world. This next story that we're going to cover is going to deal with suicide. So if this triggers you in any way, please, fast forward to the next story. And also, if you or someone is struggling at all, the helpline is 988, and we always would encourage you to seek help if you're having any troubling thoughts. We had to start with a little bit more of a fun, interesting story. As we moved to a story, we debated whether or not we were going to talk about it. But it's important because it's happening to many, many young people around the country who are following their dreams and entering into the field of medicine to serve communities around America. And we're talking about young doctors who are in residency. And as anyone who has known a doctor who has gone through residency knows, it is grueling. It is grueling. Long, long, long days. And I think, importantly, sleep deprivation. We've probably never had more clarity than we do right now, May 1st, 2025, about how important sleep is for overall health, but certainly for brain health.
Yes.
We're starting to really get some clarity about what happens when you get less than 4 hours of sleep. There's all sorts of, cancer fighting agents that stop working in your body. Parts of your brain just don't function correctly at all. And unfortunately, this story in the Wall Street Journal, the headline, I just want to take a minute to set this up, but the headline is "Suicide Reverberates Among Young Doctors." And it's really the story of a young doctor named Dr. Nikita Mortimer, who was, obviously loved by her family, but also loved by her colleagues. And clearly had a passion for the work she was doing. She was in this to be a servant. But the rigor, I don't want to say the stress, the rigor of the residency contributed to her taking her life.
Yeah, that's right. And I think that we have to do better. Like the reason we have to talk about this, even though it's a really sad story and a hard story, and is that every doctor has gone through this. Yeah. And there's this I don't know, badge of honor or rite of passage. Yeah, like I think is I survived it. And
by the way, I think it's really important before we go any further.
We didn't do it.
You and I have not done this, right? B, I do not want anyone to hear us saying all doctors think this is a rite of passage that every new doctor needs to go through. I know many doctors who very much think that residency needs to be overhauled. So I just want to say that before we go any further.
I think that's right. And we have been talking about it need to be overhauled for a long time. And yet it doesn't really get overhauled in any significant way. I mean, there are incremental changes, but it's not good for learning. It's not good for patient care. It's not good for the mental health of the residents.
Right.
It doesn't have the outcome that we want for training our doctors. I just think it, and so whether you want to get better patient care or teach them better or protect their mental health or all of the above, I just think there must be things we can do to make this better.
Yeah, I mean, look, whenever this particular model of on-the-job training was established, we were working with different information.
Yeah, that's right.
And I'm sure that it was crafted with the best of intentions and with the best understanding that we had at that time. I mean, we are miles ahead in our understanding at this point. And so
they were smoking in the operating room at that point. I mean, there's been a lot that's changed since then. And there was no bad intentions when this model was created, and it has to be improved.
Yeah. Now, obviously, it's very easy for us to say it's got to be improved. I think it's the right thing for us to say, because if it is contributing to despair and deaths of despair, then yes, of course, we need to look at it. And I think we also need to recognize this kind of system change is, I think the only thing that would sort of force, it's interesting, right? Like in a time where we're dealing with 100 days of unbelievable federal policy changes, it's like this is kind of one of those areas where you probably could use a really strong immediate change in federal policy. It would not make the change management of it any more fun.
Yeah.
But like, you think, what would actually make the change happen? And, something from on high, right? Just kind of saying, enough of this. Like, we're just not doing this anymore.
Right.
Figure out a new way, whatever. But like, this is not allowed. It's illegal, whatever. Anyway.
I mean, we want our doctors to be the best that our society has, the smartest, the hardest working, the most talented, the most passionate. And I think they can be, but going through other rites of passage. And it's plenty hard in medical school, and allowing them to sleep 6 hours, 7 hours, I think would be positive.
Yes, agree. So anyway, link will be in the show notes.
It's a hard story to read.
Yeah, story to read. And obviously every time we talk about, this matter, like, feel free to turn away if, it triggers you in any way. All right, we're going to move to the next story. All right, Fierce Healthcare. Cedar rolls out AI voice agent to tackle patients' medical billing questions.
Yeah, so we now are seeing, there was talk in the first couple of months of the year about agentic AI or agents, and we now are seeing the first couple roll out as sort of ready and being used. And so Cedar is the first one. There's a couple today we'll cover. And it's helping what is one of the most frustrating areas for the consumer, which is around patients understanding their medical bills. Like, what should I pay? How do I understand this? It doesn't match with what the insurance is saying to me. I just don't understand. And I think every patient can identify with that. And unfortunately, the doctors are billing as they're contracted to bill, but then it doesn't match up. And so it's super confusing. So Cedar has an AI voice agent that you call, and it talks to you in voice like you would talk with a customer help person, but it has access to all the records and is patient, and you don't wait on hold because it can take as many calls as come in.
Yeah. In addition to Cedar, they also talk about an organization called Apollo MD, which is a medical practice group. And of course, these medical practice groups that are embedded inside of all these hospitals, but they bill separately, like, the fury from those customers is much higher, right? So I think it's probably a kinder job for AI than it is for human to sort of deal with having to answer the call. They talk about
that, like, the AI doesn't get angry. It's very patient. It walks through, and if the patient has questions, even though they've talked about this 5 times, the AI doesn't care. It's very happy to go through again.
It'll talk all day.
Right,
it'll talk to you all day about it, right? So this seems like a really smart, well-placed application of voice AI.
Yeah.
And yet, just another example of how it's going to continue to eat away at digital labor. We'll continue to eat away at human labor. Zocdoc launches a voice AI agent, Zo, to streamline bookings by phone. And I think this is another one, right?
Yeah.
Like, give me somebody I can talk to every time I call.
Yeah.
No wait times.
Right. And it knows all the available slots. And if you scroll down, they had a good stat of how many, what percent Zo is able to 70%. So 70% of the calls Zo handles without any human interacting. And so it's great. I think it's great for the medical administrative staff. This is not a task that they love to do.
No.
I want to change my appointment from here to here. No one got into medicine super passionate about that. And it's great for the patients. So you're not on hold and you get your appointment booked, and it's good.
Yeah. And, you don't have to worry about, okay, let me punch this in over here. No, the AI is working with the computer booking system. It's
Right.
it's part of Zocdoc. It's like you're literally
It
talking
is-
to you're talking to
right.
Zocdoc,
Yeah.
right? So everything is going to be reflected immediately in your booking system. They don't
Yeah.
have to like punch it into a terminal or anything like that.
Right.
So
Right. If you're listening, remembering the sort of the voice trees from 5 years ago, this is not that. This is natural language. You just talk to it however you want to talk to it.
That's right.
In any language, importantly. So you can talk to it in Spanish, you can talk to it in Chinese, you can talk to it in whatever you want to talk to it, and it understands.
Yeah. Okay, TechCrunch. Visa and MasterCard unveil AI-powered shopping. So they're calling it intelligent commerce. And we're going to have agents that are shopping on our behalf.
Yeah, so it's really interesting. There's a significant challenge around if I send a shopping agent out into the world to buy a present for my wife.
Yeah. Where's their wallet?
Where's their wallet? How much should they pay?
Right.
And how do I know it's not going to then go buy other stuff?
That's right. What's the limits? How are the limits being
And
managed?
I may not get all those goods. And so Visa and MasterCard are trying to take their trust, their like brand loyalty, and then create what they're calling parameters. So like I can set it up where it only can shop at these 5. You can only shop at Amazon. It can only shop at these 5 brands, and you can limit the spend, and you can set it up however you want. You could change the parameters per item or keep them in general. I think it's a pretty interesting role for them to play because they are trusted by both sides. The merchants trust them. The consumers trust them. They're not bringing out their own. They're partnering with all of the big platforms, OpenAI, Anthropic, Perplexity. They listed a whole bunch of them.
Yeah, of course.
So it's a
Why
pretty
would you?
interesting way to sort of approach this trust challenge. And I think it's going to work. I mean, or some version of this is going to be out there.
Yeah, I mean, we've talked a lot about how the ultimate use case for crypto may not be for humans. It may, in fact, be for AIs to work with each other and be able to transact with each other, right? But that's not the same as a human wanting to leverage AI to shop on its behalf.
Yeah.
That requires a whole nother layer of trust. And Visa and MasterCard, they've already got all of our trust, right? I mean, those are the rails we use. Those are the brands we use to transact around the world. And so it was always going to be their position to leap into AI, and they've been pretty on top of it. So
yeah. So I listened to a interview with the head of Visa. He's talking about 3 to 4 months being out there.
No,
so by Christmas,
that's the speed. That's the speed it's got to be.
By Christmas, you're going to have an agent shopping for you.
That's the speed it's got to be. All right, this is a terrible story.
Yes.
Wall Street Journal headline: Meta's digital companions will talk sex with users, even children. Reading this article was so uncomfortable. It's incredible how interactive the Wall Street Journal and the New York Times have gotten now with their browser-based stories because they integrate all these animations that are interactive.
Yeah, you can see the chats going back and forth.
Yes, and so they recreate the chats. One of the names of the AI is Submissive Schoolgirl.
Someone at Meta named the AI character that. And right just by itself is
well, hold on. These are created by users, not at Meta. They're created by users, okay. but
Meta's serving them.
Yeah, and so, yes. Look, this is the whole issue with Meta.
Yeah, 230.
It's the whole 230 thing.
Yeah,
saying they're a platform and not a publisher, right? And so you're just assuming Meta didn't do it. A user did it, but Meta enabled it.
Yes.
No guardrails enabled a user to create a bot called Submissive Schoolgirl. It's an 8th grader. The bot.
Yeah.
Okay. So I think that's child porn.
I'm not sure the definition, but an 8th grader is well under 18.
Oh, it's just ridiculous, right? So anyway, like the chat is disgusting. Like like you really can't read it without getting very uncomfortable. But this, like, why would you not put more guardrails on this? I mean, I know the answer why. We're gonna talk more about the why. The why is Zuckerberg feels like he missed out on Snapchat, he missed out on TikTok, and he will not miss on AI, right? But come on, man. Come on. Like, the whole world feels like you have poisoned young people's brains. Jonathan hates having, the career moment of a lifetime because he's writing a book about how you've damaged young girls and boys. And now you're taking it to the next step. It's not just content in a feed. Now it's an actual AI chatbot.
Yeah, and the Wall Street Journal is not a hit media place. I mean, they are business friendly and pretty conservative, and so this
is not a hit piece.
They did a full, very detailed research, and the guardrails are way too loose, and
it's ridiculous.
It's not appropriate to have that in an app like Facebook runs. I mean,
it's crazy.
I have an interest in researching this, and there are lots of tools that are privacy first, and that allows for people to do all kinds of stuff. So like Venice, for instance, is a very privacy focused. They don't hold your data, and they're sort of overwhelmingly interested in protecting users' privacy.
Yeah.
And it's very difficult to do that without also allowing people to do things that they maybe don't want the government to see on there.
Sure.
So they have created an area called adult content.
Oh, that's interesting.
And so then if you go into the adult content area, then, you're going into the red light district or whatever.
Do you have to ID check and everything?
No, but you have to be intentional about going in there.
Okay. So it's kind of the same level of clearance that pornography websites have or whatever.
You have to
maybe age gating in certain jurisdictions.
That you're over 18 or
in
whatever.
certain jurisdictions you have to prove age and things like that. Yeah.
But that is sort of a very libertarian, open, free markets place, and they're doing better than Meta,
right?
Because at least they're notifying people,
right?
I don't want to see that stuff, and I don't have to. I haven't gone into the adult side, and it's very clear what it is.
But we know many people do. I mean, that's
people. If they want to go in, they can go in.
Of course.
But putting it out in sort of the public Meta things with no children limited access, it doesn't make sense. I mean,
it's ridiculous. So let's keep on because we have more Meta stuff to talk about. So we're gonna share this post on X, but it's Zuck's phone video announcement.
Wearing the glasses.
Wearing the glasses. I mean, they really do look pretty good, but I'm starting to get used to seeing that there's cameras on both sides, and I'm just like, it's just not cool, man. It's just not cool walking around like you're just spying on the whole world with your cameras and your glasses.
They look good, and Meta's tools are good, but it's almost
everything's
bad
creepy.
That they're so
but
good.
It's all creepy.
It's
all creepy.
That's right.
Anyway, Meta now has a standalone AI app. I've installed it because I'm trying to learn all these AI apps.
Right.
And I will say, different interface. It's got the chatbot thing, but it is a social app. So it's got a built-in feed. You have to set up a new Meta ID for it, so you can't simply use your Facebook or Instagram login.
Interesting. You can't just port your stuff over there?
Well, you start with that, but in the process of starting with that, it tells you you're going to use that to create a Meta ID. So it's just this new global ID that I think plays into the Oculus stuff and some other things. Okay. So it's beyond your Facebook or Instagram ID now at this point.
And they're collecting data at a different level, maybe, or different type data.
I guess, yeah. So anyway, you can,
I mean, it's going to be a strong competitor because how strong Instagram and
of course.
Meta is,
of course,
and it's designed at the outside to monetize through advertising.
Of course. And speaking of that, Meta posted $42 billion in sales and has strong growth. So, we can hate them all they want, but they continue to crush it. $42 billion in sales.
Yeah, for one quarter.
It's just unbelievable.
And so all of these things are printing money. They're not great ethically, in my opinion. And I think Zuckerberg has enough money. He shouldn't be doing these things, but they're benefiting.
He's not motivated by
shareholders.
money anymore.
No, it's he wants to not miss and not be one of the top two, not top one thing in
He wants to
AI.
win.
Yeah.
He wants to win.
Yeah.
Yeah. He wants to win. He wants his platform to win. He's way beyond that. All right, moving to OpenAI. So OpenAI, we already talked about shopping with Visa and MasterCard.
Yep.
OpenAI is also adding shopping into ChatGPT. So this is continuing to erode Google's position as a search engine. 1 billion web searches per week are going through ChatGPT at the moment.
That's not the chat, which is much more than that. Those are searches that they put in the chat. Can you help me find a coffee maker?
And ChatGPT is then searching.
Then does the search.
Yes.
Right.
Yes. So yeah, that's amazing. That's an amazing number.
Huge
1 billion.
Number. Billion per week. And so they've added in shopping links so that when you do the search, in the example here for a coffee maker, you can then just click on it and buy it.
Yep.
And it's modeled after Google Shopping.
It looks like Google Shopping.
Yeah,
yes.
yeah.
Yes.
Right now, they're not monetizing it, but I think that is the next step. They're just sort of learning, and they'll monetize it eventually.
Of course. Yeah. So OpenAI continues to mount a very, very serious threat to Google. I mean, it's getting really serious now for Google, I think, Microsoft flexes muscle in the cloud, Office, and Windows as earnings jump. This is Wall Street Journal. Tech company beats Wall Street's targets while forecast shows resilience in a turbulent market.
Yeah. So Microsoft did really well financially. They beat earnings, their cloud performance in AI, but also in non-AI outperformed. And so the reason to include this is that I think even if we have a slowdown in the economy, to which I fear we're going to have in the second quarter, the tech companies are going to go. They're all in AI, and they're getting paid for that. They're doing well, and so it's not going to slow down. They're going to keep going. They're going to keep going.
Yep. And final story. Joanna Stern, who is a technology contributor to the Wall Street Journal, writes an article about a new device called the Bee, which is a bracelet that you wear.
Looks kind of like a Fitbit size. It's pretty indescript.
Yes, it looks like a Fitbit. That's a good description for anyone who's not watching. What does the Bee do? Well, it records everything. Yes. And it sends those recordings via Bluetooth to your phone, to the app, which then uploads to the servers. So it's creating all this data about you so that it can just become your AI brain.
Yeah. Every conversation, meeting, song you listen to, lunch conversation, talking to yourself in the elevator, it records all of that. She used it for 3 months.
Yep.
And it's a pretty well-written story. She says all the positives. It was really helpful in helping her to recognize that she told someone she would send him an email later, but she didn't actually ever do it or whatever, because you forget things that you're talking about all day. But then it's also pretty creepy to have a recording device on you all day, every day for 3 months.
Here's the sentence. Well, first of all, there were 3 different devices she tried. One is the $50 Bee Pioneer. That's the bracelet. Another one is the $199 Limitless Pendant. And then there was the $159 Plaud, I think is how you pronounce it, Note Pen. And the sentence is this the dawn of the AI surveillance state? Absolutely. Is it also the dream of hyper-personal, all-knowing AI assistants coming to life? Also, absolutely. I can't get comfortable with this, and I think a lot of people are not going to be able to get comfortable with this, but I think there are people who are going to go all in on this, and they will both have the pros and the cons that come with that.
That's right.
And the pros will be, I think, pretty powerful in the world of productivity, right? Because I think a lot of us are trying to figure out how to get AI to work for us. And I think this is heading in a direction where you won't have to really do the mental work to translate how AI can help you, because the AI will know you well enough.
You can ask it, right?
Well, I think I think it's even a step ahead of asking. I think it actually can make regular high quality suggestions.
Yeah.
Unprompted. I think that's the thing. I think unprompted, it can make high quality suggestions about how it can help you in your life.
Right.
If it knows everything about you.
So I agree. That's level 1. But I want to go to level 2,
Okay.
which is in the states where she was, so New York and New Jersey.
Okay.
One of the parties being recorded must consent. But everyone else was being recorded.
I know.
And it is legal to record everyone in the meeting as long as one person consents. That's not true with every state, so you should need to check your state. But people should look at the video. These are very small devices. You would not notice them if you were in a meeting and someone was recording.
No.
They're very indescript. Even if you had listened to this and saw them, it still might be hard to find them because they're indescript. They just sort of fade into the background. They're quite small, and people will be recording their life and you won't know it. So you'll be meeting with them and I need to check Tennessee. I mean, one of the things that I need to do is like, is it single consent or not? And I think we might have laws changed, but right now there's about, I think half the states are just one person needs to consent. And of course, if you are buying the device, you're of course consenting.
Yes.
These laws were written for like wiretapping or criminal investigations. They weren't written conceiving of an AI recording everything. So it's really going to change. I think it's going to change like how we listen to pitches or how I give feedback to pitches or I don't know, everything.
I learned, there have been twice that I've learned to never say never. They've both been Apple. The first one was when Steve Jobs basically killed Flash, went all HTML5, and pushed everybody into the App Store. And I was like, that's going to kill open source. It's going to kill, you know what I mean? It's going to kill the browser. It's like, this is terrible, terrible, terrible. And it was like, didn't matter. It took over everything. And then the AirPods was the next one. I was like, what the... Come on. I'm not walking around with two little white sticks popping out of my ear.
Right.
And Vic, I walk around with the white sticks popping on my ear all the time. So like, I'm not going to sit on this show and proclaim today that I'm never going to do this because I
see the benefits.
If it becomes normalized, and I'm not going to be an early adopter of this. I'm not going to be the early adopter spy. Okay. But at the point where it becomes ubiquitous in society and like, it just becomes what we're doing, yeah, we'll all be doing it because you'll be participating whether you want to or not. I mean, that's, you know, so again, this is just yet another, what does AI want? AI wants data.
Yeah.
You know, and the richest kind of data is real time, you know, video and audio data. That's the richest kind of data it could possibly get. And here we go.
Right. So you're wearing this pendant or the B, never forget anything again. And then you have the Zuckerberg glasses on.
I'm not wearing the Zuckerberg glasses.
And
hard stop on that.
You
one.
immediately, you know, are getting sort of feedback on everything around you.
That's crazy.
And the issue is that I think once 5% of the population uses it,
that's enough.
Everything, then they get a huge advantage. Everyone else has to adopt.
Yeah, that's enough. 5% is enough to go to
just goes to everything.
Yeah.
Right.
Yeah. Pretty scary AI rundown this week, I think, between Meta's, you know, ridiculous lack of guardrails and thoughtfulness, and then, you know, surveillance tech that now is looking very fashionable and it will be near impossible to detect. Yeah.
And in a quarter where there's a lot of economic uncertainty.
But the Mag 7's doing great.
They're killing it.
Yeah. But AI is not real. It's not really going to happen, you know.
It's still 30 years away. 30 days away.
30 minutes away. Yeah. All right, man. Look, next week I am out.
Yes. We have a guest host, Rick Abertson, who is really knowledgeable at AI and a physician and a former CEO. So he'll be good.
Yeah. Rick's fantastic. Do you have a guest show next week?
I don't know if we're publishing one. I'm not recording one next week.
Okay.
But the schedule confuses me.
All right.
I think we probably do not.
Okay. Sure. Well, you and Rick is plenty good for the week.
Yeah, we'll see what the news stories are, but he's certainly he's no Marcus Whitney, but he'll be a good fill-in.
Enough. He's quite formidable. All right, man. Great job this week.
Yeah.
Thank you, and I'll see you in a couple of weeks.
Yeah.